o'clock. So we'll call the December meeting of the Waushara County Board of Supervisors to order. We'll start out with roll call. Okay, and we're all present and there's a quorum. If you'd stand now for a silent prayer and pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, you all have an agenda in front of you. You had a chance to look it over. Is there any additions or corrections to that agenda? If not, I'd look for a motion to approve.
So move, Mr. Chairman.
Moved by Wadel. Is there a second?
Second.
Second by Mr. Bossert. Is there any discussion? All in favor?
Aye.
Opposed? All right, and we had a meeting on November 19th, a special meeting. And those minutes were sent to you. Is there any additions or corrections to those meeting minutes? Otherwise, I would look for a motion to approve those.
Motion to approve.
Motion by Mr. Urban. Is there a second? Second by Ms. McCormick. Is there any discussion? All in favor?
Aye.
Opposed? All right, it passes. Public comments tonight. We have one for public comments. Sam Wood.
How's it going? We'll make this one short and sweet. Still waiting for a resignation or termination of one of your county employees, but let's move on. The broadband. I got what I got out of the minutes. It's pretty non-informative, but I do know that the county is in bed financially with Bug Tussle. So how is this going to affect Bug Tussle? I mean, before we kind of commit to even backing somebody, we need to make sure we don't bankrupt our partners. So that's something that I just want everybody to be aware of. I don't know where the coverage is. I don't know where the overlap is. I mean, I'm all about capitalism, but I'm also all about taking care of my partners. Just something for y'all to think about. We are financially in with Bug Tussle, and I don't feel like going to an auction and trying to buy Bug Tussle crap. So just beware. Think about that.
Okay, and that was the only public comment tonight, so we'll move into new business. And we have no unfinished business. We'll move into new business. Reports and presentations. First is our county administrator's monthly report with our administrator, Megan Kapp.
All right, thank you. First board meeting as officially as county administrator here. So since last month, since I've taken over as administrator, I have started one-on-ones with all of our department heads. I've been working with them to identify some priorities, goals, challenges that they have, and to see where they need support from administration. So I'm inviting all county board members as well. I'd like to set up a time to meet one-on-one with each of you. So if you can reach out to me either email or phone, I'd like to set those up so that you guys can come in and we can have those same discussions from a county board perspective so that I can outline some of your priorities as well. Ideally, if we could do that before the January board meeting, that would be great. So if you can take a look at your schedules, you can connect with me after the meeting as well. Also, since our last board meeting, our new highway commissioner, Jason Skalecki, began December 2nd. We also have Dave Sturts working as a consultant with that transition to help him over there as well. Melanie Stake started on November 22nd as our interim county clerk. Obviously, she's not here tonight and I'm still clerking the meeting. So I'm working together with her and Nicole in the clerk's office to make sure that we have coverage for meetings and that all those things are getting done. Melanie's primary focus is on the elections piece. So they are still working on cleaning up things from the November election and already prepping for the spring elections as well. So working closely with her, and again, she'll be on board through April until that special election is held to elect a new county clerk. Other things going on lately. So I've been participating in initiative one's leadership transformation. So a few months ago, the board passed a resolution to support that leadership transformation program through the public health department through a grant that they have. So there's about 12 of us going through that program right now, working on transformational leadership, positive accountability, understanding behavior and emotional intelligence, and setting boundaries to increase personal impact are some of the topics that we focused on thus far. We've been through, I think, about 4 sessions, and so we have several more of those coming up this month and in the new year. Along those lines as well, I'm initiating beginning in January. There are monthly think tanks offered by Initiative One that I'm going to bring in the department heads for, so that we can have some of that team building and ability to connect and grow as leaders of the organization. So starting that in January. We've continued work on the wage study with our consultants' risk strategies. On the agenda tonight, we do have a resolution for some recommended reclasses for some financial positions. The reason being on those is there were some prior requests for reclassification over the last couple of years that were put on hold with the intentions of doing a deep dive into the financial positions with the wage study this year. So I am recommending we move forward with a couple of those at this time, although we are still continuing work on the full wage study. Let's see. Just a quick update on the old courthouse. So at the last facilities meeting, the committee did select a company for demolition of the old courthouse in North Annex. So they'll be moving forward with that after the first of the year. We had a meeting with folks from the Y. They are continuing their public fundraising campaign, and as a requirement for one of the grants that they received, they do have to break ground by July 1st of next year. So they are moving forward with their plans for that. Ruth has been working with the monument people and operating engineers on relocating the statues that are at the old courthouse, and Thursday this week at the facilities meeting, they will be discussing, they haven't determined a location for those quite yet. So they will be discussing where to relocate those. Just a reminder for those on facilities, that meeting has been moved back to 2 o'clock on Thursday. And the reason for that is we have the employee holiday luncheon. So that's our employee appreciation holiday luncheon we've done for the last handful of years. We're going to have that here on Thursday out in the atrium so that we can utilize that space out there. We have our last night of Wish Air Lights Up the Fairgrounds this Saturday from 5 to 8 at the fairgrounds. So if you haven't been out there for that, there is one more chance to get through there. And a reminder, we are closed next week, Tuesday and Wednesday, for Christmas Eve and Christmas Day. And then the other thing I just want to note is that we are continuing to move forward with strategic planning efforts. So the strategic planning committee this month met out at the Poisippi Center as part of their initiative to make sure that they are touring and getting around to each of the facilities. The plan for 2025 is for maintenance to develop a ongoing facilities maintenance plan to document replacement costs and needs, lifespan of everything in all of the buildings, so that we have an inventory of that. And then along that front as well, Tim Baru from UW Extension has been facilitating and educating department heads to get them ready and begin first steps on departmental strategic planning. So the goal is for all Washington County departments in 2025 to go through and develop strategic plans so that they're able to identify long-term goals and priorities for the county. And I think that's everything I have.
Okay, does anybody have any questions for Megan? Okay, very good. Thank you. Very good first report. Thank you. Okay, then second, we have medical examiner's annual report with our medical examiner, Amanda Toma.
Everybody hear me?
Yeah.
I'm Amanda Toma. I am the medical examiner in case you haven't met me yet, which is probably a good thing. This is my annual report, but it will only go through November of this year because obviously we haven't finished December. So without further ado, I can figure out how to. Clicker's not working.
Is it on? It's green, right? Try it now. Yeah, great.
So this is our current staff members. We have myself, Heidi, and Hillary. We have 2 vacant positions where we are filling the ones that you had approved for the 30-hour part-time deputies. We have 2 offers out there. One that has accepted and hopefully will be beginning her employment with Waushara County as of the first of the year or later on this month. The second is a conditional offer. She still needs to continue through her testing through ThedaCare, which we ask for everyone to do that is an applicant that is moving forward with the process. And she will begin her employment, hopefully if everything goes as planned, in May or June. And both of them are relocating to the area. So they are looking for housing and trying to secure that prior to their beginning of employment here. As you know, we take care of different manners and types of deaths. We take care of natural, suicide, accidental, and homicide. There is one more on a death certificate, and that is called undetermined. It does not get used very often. When it does get used, it is for those deaths that we have that we cannot determine, maybe if it's an accident or a suicide, or if we have someone who was left behind and has not been found for a significant amount of time, and we cannot determine that cause and manner of death. That gives us that opportunity to put undetermined so that we don't put something wrong on that cause of death or manner of death for that individual and their loved ones. The natural deaths we deal with, typical, the cancer, the natural disease processes, we deal with suicides, and then accidental deaths, which are really interesting to me. And it's a huge category because when we think of accidental deaths, we don't always, the general public thinks of vehicle accidents, right? Accidents that occurred on the roadway, accidents that occur with UTVs or ATVs. Accidental deaths actually encompass so much more. We have potential for unintentional overdoses. We have the ones that have hypothermia. Maybe somebody who has dementia has left their home and can't find their way back. We're entering the colder months. We do have those incidences that occur here. We have people that are drowning victims. They are deemed as accidents. The ones that are incredibly interesting that many people don't know about are when somebody has an injury from a fall, a fractured hip, a fracture of some sort, and subsequently dies because of complications of that, that is determined to be accidental as well. So sometimes we have the elderly who have a significant disease process, but because they had a fall with maybe recent surgery or recent issues with that, it could be determined that they died from complications of that fall or that fracture from that fall, and then it is deemed accidental. This is our yearly overview, and obviously this is January through November for 2024 and comparative analysis to 2023. As you can see, in 2023 through December, there was 214 cases. We are over that as of today for 2024. It's interesting because when I was counting out these deaths and doing all this, we actually had exactly 143 natural deaths in 2023 and currently through November at 143. Obviously that's increased now. The suicides have been the same. Accidents went down, and last year we had an anomaly year. I like to call it that. We had a lot of accidents, vehicular accidents that had caused the deaths of several persons within one accident. And that's where that higher number comes from. Last year we did 26 autopsies. This year we've done 13, and hopefully that number will be stagnant at 13. This is a breakdown of the monthly data, January through June. As you can see in our colder months, and as January begins, it does increase, and then it'll decrease a little bit until the summer months, and then it increases for a couple of months. And clicker, please. And then you'll see July through November. July will increase, August, and then when the kids go back to school or when fall comes, it decreases until those winter months come along and increase that. So I loved Stephanie from GIS's Land Records presentation so much when I got to watch it. I asked her to complete a map for me, and these are incredibly interesting to me. She took the locations of all of our deaths as well as the type of death. So either natural, accident, suicide, homicide. And she had it pinned on these maps for me, and we're calling them heat maps. And as you can see, obviously there are some that are located outside of Waushara County, because sometimes what happens is there's an accident that occurs here, that individual is transported by EMS to another facility. It's out of county, but that is still our jurisdiction if the death is related to that accident. You'll see that the blue is natural, orange is accidental, and in 2023, we had 33 of them. Obviously, you don't see 33 orange dots up there because the way the heat map works is that they're piling on top of each other wherever they occurred. Okay, so if we remove those layers, you would be able to likely see more of those dots. And then we had the purple, which is suicide, and then we did have the one homicide in 2023. In 2024 through November, we did the same thing, and you can see that, you know, the blue natural and then the orange accident and purple suicide. What is really neat about these maps that Stephanie and I were talking about is we can do various things with these. So if you peel back the layers and only have the accidental deaths on there and then remove the ones that were caused by a fracture or multi-drug toxicity or hypothermia and only include the ones that were either vehicular or on the roadway, we can actually show the Highway Traffic Safety Commission, which I'm a part of, where these accidents have occurred. Like if there are intersections that are of concern that we need to bring attention to, which they are actually, they do their community mapping, which is similar to this as well. So we can share this data with them. If you put everything back on and remove everything except for the blue, which is natural, and we can actually look at the cause of death for natural and look at maybe some of the disease processes or some of the related illnesses like bacterial infections, we can share that data with public health as well to show them where there may be a cluster of some type of bacterial infections, tuberculosis, COVID, all of that kind of stuff, and share that data with them in hopes that they can help their prevention efforts as well. So I talked a little bit about autopsies, how we did 33 last year and how it was so high, or 26, I apologize, and how we did 13 this year. Obviously, there was a very large increase. We had an anomaly last year. We are actually in our budget right on with our autopsy budget that we had increased last year because of the interesting autopsies. And I know that sounds a little bit odd, but the autopsies we've had have been ones that have been completely delved into that have taken a long time to complete because we've had to reach out to colleagues in the toxicology area, in the microbiology area, that have helped us to identify maybe a toxin or something else that had caused this person's death. When we do autopsies, oftentimes our toxicology is sent to the state lab. It can take anywhere from 4 to 8 months to get back a final toxicology report. And when they send those back, they don't put a number to all of the drugs that are found in someone's system. They only say that they're there or they're not, so present or not present. And if we find that something might be present in their system that we need to quantify, then we will send that out to a specialty lab. And so it takes extra time to be able to do that. And then the pathologists will also work with their colleagues to help identify different things. So these autopsies that have taken place this year have been very, very a deep dive into this person or these persons that we have taken care of. And a lot of the causes of death on the right are ones that we've had through this year. We have found that people had undiagnosed scoliosis and that was what causing their back pain. Had nothing to do with their death, but it was undiagnosed. You know, atherosclerotic heart disease, coronary artery disease, they didn't even know they had. Okay, it's intriguing, but it's also very helpful in terms of public health to be able to identify those for persons as well for extra care for them and preventative measures. So death certificates, we have signed out 164 this year with cremation permits at 152. We have noticed that traditional burial is coming back, which means that there's going to be less cremation permits than there would be normally issued. We don't know why, but maybe there's a new trend happening or a you know, cyclic type of trend happening. I always bring this back on my annual report just to share with you how long it truly takes to have a death investigation done. So we attend all unattended deaths outside of hospitals. So anytime somebody passes away at home, in a CBRF, in a nursing home, in our county, we take care of those deaths and we attend those deaths because they weren't in the hospital under hospice care or physician's care. Sometimes we will attend ones at a hospital if there is an injury or a suspicious death that we are informed of. These death investigations do take hours to complete. By the time we get there, we talk to family. We always talk to family. We want to know their medical history. We want to know their background. We want to know what they did for a living. Sometimes we have veterans who have been exposed to Agent Orange, and we can relate that to their cause of death as well. And sometimes we need to know their social activities as well, especially when we have those accidental overdoses that we really need to dive into. Gathering medical records is relatively easy for us. I have access to Epic through ThedaCare, so I can access pretty much everybody's medical records that comes through our office. For those that are not in the Epic system, we do have to request from that hospital that they did attend to from the physician so that we can kind of see what was happening with them the last few months. And obviously I did let you know about the autopsies and toxicology, and that can take anywhere from 6 to 8 months to complete an autopsy report with the cause and manner of death on it. So part of my job that I really enjoy doing is being able to go and talk to the community and our youth. And this year I was able to go to the Tri-County Schools Career Day. And apparently I was a hit because 2 weeks later they were still talking about me, which is good because that means we're having an impact. That means that we're sharing the information that isn't already out there, which is also what happened at Watoma High School in October. These are 2 essays that were provided to me by Officer Hendrickson, who teaches the criminal justice class there. And he brings in all different kinds of persons to let the students know what's out there. What does the government do? What do we do as public servants? And everybody knows that I love the aspects of Bugs and Bones, and these letters have that distinguished in there, that how we can take someone who is not found for quite some time and be able to find a cause of death, or be able to know that person a little bit more than what somebody normally would know them, or that bugs can help us determine time since death or some type of drug or substance that was found with that individual. So it's really great to get that feedback as well. This last year training was a little bit far and few between because we were understaffed, so I wasn't able to leave for training at all, but I was able to go to some webinars on child abuse. I attend that one every year. They are able to share with us what we can distinguish between accidental deaths in children and intentional deaths in children, and that helps out, and we're able to build relationships with different colleagues to be able to reach out to them if we have any questions on our cases. And Dr. Michael Baden, he is a forensic pathologist out of California. He's most notably known for the O.J. Simpson case. He did the autopsies for that case. He is about 90 years old at this point in time, and this is one of the last talks he probably will ever give. And I always take away something from his talks because he is so knowledgeable in the area. And then Monday, I actually was able to attend online the MEPA virtual conference, which is the Midwest Injury Prevention Alliance. And they look at different types of injuries that occur from birth until the elderly to try and prevent those and give us strategies to help prevent them. I attend that, 1, because it's free, and 2, because it gives me an idea of, okay, were certain persons provided information from our public health or from MEPA to be able to avoid injury, and then I can recognize that on the time. One of the really great things about my job and the benefits of my job is tissue donation. Nobody really talks about it, but what the best part about it is somebody to be able to share that gift, the family to be able to share that gift from that decedent. Currently, I know it's really hard to see on there, but 55% of the population of Waushara County is a registered donor on their license or identification. Now, what that means is that when I come on scene, if the family says we want them to be a donor if possible, I will work with the American Tissue Services Foundation to be able to try and make that happen. There are certain requirements that they need to meet to be able to have that happen, but we always try to do that. The families really appreciate it, especially if that's that person's last wish to have that completed. This is the type of donation that can occur through American Tissue Services donation, which is corneas, veins, heart valves, long bones, skin, and they will have this recovery take place at any of our local funeral homes, at the hospital. So we really try to accommodate them to make it happen. We also work with UW Organ Procurement Organization, where donations occur in hospitals. Now, those donations are usually organ donations. Those are the ones where somebody has sustained an injury or some disease process, and the likelihood of them returning to their full capacity isn't going to occur, so the family has chosen to donate. Now, these types of donations, the way they occur are similar, but they're also very different. When ATSF comes in to do the recovery, they're incredibly respectful, but the donations that take place in the hospital, if anybody has ever been a part of that, are incredibly moving. The family provides an excerpt of that individual and shares a bit about their life. And that is actually read right before donation occurs. And I have been lucky enough to partake in both types of donations. And it is an incredible thing to see, because that person can save anywhere from 2 to 75 people, depending upon what is donated. One person. Okay. So what's moving forward for the medical examiner's office? I always like to forward think, because I want to make sure that we're doing the best we possibly can for Waushara County and the visitors of Waushara County. Currently, we have moved to the front offices of the old highway shop. We really appreciate that. My deputies are incredibly happy with that move. They have room to work. We have a secure location for our specimen and our evidence. And now we're looking at the renovation that I'm sure you all have heard of that center area in the highway shop, which was the sign room and the lunchroom area, into the cooler and more room, 2 offices, as well as that restroom. So I'm working with Mike from facilities, Mike Lechner, in those plans and moving forward with that renovation in hopes to, service Waushara County residents as well as those who visit us with the best that we possibly can. As you know as well, we are going to be providing medical examiner services, to Marquette County starting the 1st of January. I just put that map up there so you can see the square mileage of what Waushara County is, and then the additional territory that we are taking on, just so you just can encompass that full capacity of what we are servicing. I will be there starting the beginning of January for a couple of days for their in-service training for law enforcement to help that transition along. I really appreciate your time. If you have any questions, I'd be happy to answer them.
Does anybody have any questions for Amanda? I have just one for you. When you talk about the autopsies, are there any of them that are covered by any type of insurance, like a life insurance or anything like that? Or, I mean, is there anybody else that requires them, or is that just something you ask for or whatever?
So when we investigate a death, the whole point of the autopsy is to determine cause and manner of death. If we request that autopsy, the county does pay for it. However, there have been incidences, and the family is always welcome to request a private autopsy. It just needs to be through a different pathologist. So they can't go to Fond du Lac to be able to obtain that autopsy. And we have had that many, many times where families would request it, but they do have to pay for it. The county will not pay for that autopsy.
I didn't know, like life insurance or somebody would, just to determine. Okay. All right. Does anybody else have any questions? Okay, seeing none. Thank you, Amanda. Very good report. Okay, next we'll have our bug tussle report from Mitchell Olson, the bug tussle Chief Development Officer and General Counsel.
We decide this doesn't work today. I'll gesture to you, Barry. Thank you. I'm going to apologize in advance for the PowerPoint a little bit. The devil on my shoulder got the better of me as I've made a lot of these presentations. So this one was a little more fun to make. I apologize if it's not funny. But as he mentioned, I'm Mitch Olson, Chief Development Officer for Bug Tussle. As you all know, we are long partners with Waushara County, and we have ongoing projects that Barry asked that I come and answer a handful of questions that you guys have. So you can, next slide. So I did my best to forecast what your questions would be based on my conversations with Barry. So we kind of walked through it. So we partnered with you a long time ago. What have you done? If you go to the next slide, you'll see that we have put in about 140 miles of middle mile fiber that we do last mile service along those routes, in addition to 19 fixed wireless sites. So we have have a little over 1,000 subscribers in Waushara County. As we sit today, all of the fiber that you see there is live and there are customers along the length of it. Obviously, we are working on the sales side to increase that number of customers on both the fixed wireless and the fiber front. Some of that fiber is more recently on than others, but we've effectively completed what is kind of the first phase of our Waushara County build incident to that 2021 bond. So obviously, there's a lot of people in Waushara County that are not yet connected. Where are we going from here? And that's what we talked about earlier this summer when we did the next bond issuance. The industry term for what we are looking to do from here is densify. As you're all aware, we bonded for an additional $11 million in Waushara County, and the project that we targeted is what you see in the three colors. They are kind of divided into three portions, the northernmost of which obviously the largest, and then two roughly half-size projects in the central and southern portion of that map. North of Wautoma and south of Wild Rose. Next. And the very obvious question is, okay, now that we have that all outlaid, when is it going to be built? And that's the long and short of it, is there's a lot of moving pieces here, obviously, that we have to work through. If you want to go to the next slide. The biggest piece that we are looking at is BEAD. As you can see from that map there, and it's a little bit of a Jackson Pollock painted in a convoluted mess, but BEAD BEAD money is from the federal government and administered by the Wisconsin Public Service Commission through the state. They took a data collected by the FCC and that determined the broadband serviceable locations throughout the entire country based on the provider submissions on who has or who provides service to each of those locations, and as well as factoring in any other funding opportunities through previous grant cycles, whether they be state or federal, and determined a total number of eligible locations throughout, in the applicable case, the state of Wisconsin. From there, they divided those into project units. There are 4,300 approximate project units in the state of Wisconsin, and now it is up to us as providers to bid on those projects based on the amount that we think we can provide service to those people. Next slide. Looking into the projects that I had outlined previously, as you can see that there's very significant overlap between what we were proposing to do with the 2024 bond and the areas that are BEAD eligible. So in reality, it's in our best interest and as our partner, Waushara County's best interest, that we at least pause to take the opportunity to leverage that bond funding against what we have available to us in BEAD. Really is if we're able to get some level of match funding for that, the bond money will ultimately go further. We'll be able to deploy more and cover more people throughout rural Waushara County, as opposed to just spending all of the bond money on the project that we have outlaid there. There's a fairly narrow scoring rubric for those BEAD projects, and the county endorsement is 12 out of 40 points for how all those BEAD awards are going to be administered. So ultimately, the people in this room are going to have a pretty substantial say on who is successful for their BEAD bids in Waushara County. Barry? And next. Thank you. So that's really where we sit today, is we're looking at those projects, and ideally we would like to build that in 2025. Based on all the timelines and everything that we've heard from the PSCs, the expectation that the BEAD process at some point is going to pick up steam and move quickly. That hasn't happened yet, as they've been sifting through the federal administrative paperwork and everything that's associated with doing that. We continually have timelines set from the PSC, and they continue to kind of blow through those as the pieces slowly start to matriculate. The big piece that we are waiting for at this point is what the PSC calls the BEAD match threshold. So for each of the project units, all 4,300 of them, the PSC is going to evaluate those projects, determine a cost, and then ultimately tell you what the maximum amount of funding is available for those projects. The NTIA, the federal agency responsible for BEAD funding, put out a moratorium indicating that absent a waiver, federal funding is not supposed to exceed 75% of the total project cost. So effectively, we have to come up with 25% of each of the project costs, and hopefully our project costing models match what the PSC has, so that we're kind of in line with that threshold in the event we want to bid or maximize that money as far as possible. For projects like this, it's more than likely that we would bid more aggressively because it's good density, because we do have the bond funding available there, and it's very close proximity to the existing network that we have in Waushara County. But ultimately, that is kind of the last domino to fall before we can really put together what ultimately are we going to bid on in Waushara County and the state at large? How are the dollars going to kind of match up and how everything makes sense? And ultimately, how do we make the dollars that you partnered with us to issue this past summer go as far as possible? I'm optimistic that these projects will still take place in 2025. But ultimately, we can't say go until we have, at the very least, more color from the PSC. If we think this is something that's actually going to happen in a reasonable timeline. There's rumbling in the industry that maybe BEAD isn't long for the world, given the change in administration. Maybe the process is going to be turned on its head and have to take additional time. There's just a lot of pieces that have to fall into place before we ultimately get to the point where we're able to say, yes, this is the project we're bidding. Yes, this is the amount that we are bidding on it, and this is when construction is going to start. Talked a lot. Does anyone have any questions for me as we sit? Yes, sir.
You said that you, I mean, am I understanding this right, that you have not started on this phase 2 or densifying at all now, but you've bonded for it last year, but you haven't started it?
Correct. The bonds were issued at the end of the summer of this past year. We've been working through the engineering and design process, possibly even starting on some of the permits. But ultimately, the construction, absent BEAD, would begin in the spring.
Okay, so you don't have any kind of an update there as to where you're gonna start, or, because we're getting calls from every corner wondering when they're.
Absolutely. And if, but for the BEAD kind of considerations, is my answer would be, we're starting as soon as the ground thaws in the spring, and we're gonna start in the north. But as we kind of sift through the BEAD piece of it, there's a little bit too much variability there, because really is if we can build those projects for 30 or 40 cents on the dollar, we'll be able to do twice as much.
And but something is gonna happen if the administration says, we're not gonna do this and the money's pulled, you're still going to be doing a phase 2 or densifying. It'll just be scaled back.
And much more likely than not, we will go forward with the project that you see in front of you. Is we have the opportunity to do more, so we owe it to ourselves to at least entertain that. But at bare minimum, what we proposed originally in this summer is what we are looking at.
Does anybody have any questions?
I think I have one more slide in summary. I just want to make sure I didn't miss anything. Yeah, so that's ultimately the next thing that, the next discussion that I would like to have with the county once we have a little bit more color on what those BEADs ultimately look like. As I mentioned, the county endorsement is worth a significant amount to the process. So that's something that we would be interested in continuing our partnership with the county on. We're working on the project level designs and waiting for those BEAD match thresholds from the PSC. So ultimately not particularly ripe for discussion today, as it's all part of kind of the holistic picture. But we expect the construction to start sometime next year, pending appropriate resolution there.
Okay, and then you'll keep us updated.
I will keep you updated.
Very good. Okay, nobody has any questions? All right, thank you, Mitchell. Appreciate it. Okay, we're going to part B. There's only one item, March 2025 County Board meeting date. There's a conflict with that meeting on the 18th. So I'd like to move that to the 25th. If it's far enough out, and I've talked to Megan and she's okay with moving that. If someone would want to make a motion to move that to 25th. All right, Mr. Gray made the motion. Is there a second? Second by Mr. Kirschner. Any discussion? All in favor? Both. Okay, we'll move our meeting date then in March to March 25th. All right, very good. Consideration and possible action on the following resolution and ordinances. Resolution number 35-12-24, resolution authorizing cancellation of outstanding checks from the county treasurer. You all got a copy of those. Is there a motion? Motion by Mr. Gray, second by Mr. Peterson. Any discussion?
There's no possibility that somebody's gonna come back and I didn't see where the
They
check.
would have to reissue it. It's just gone long enough. They said so. You want these recorded here?
It's up to you how you want to do.
Okay, why don't you proceed to vote on these? And resolution passes. Okay, resolution number 36-12-24, a resolution supporting Brightspeed's application for BEAD funding. Is there a motion for this?
So moved.
Okay, motion by Mr. Urban, is there a second? Second by Mr. Johnson. Is there any discussion? We do have a representative here that we can get some information from them if you'd like. Mr. Shipley, is it right? So. Does anybody you have any questions for, is it Kelly Shipley?
Yeah, Kelly, sure.
Okay,
Okay, you want me to approach?
yeah, if you wouldn't mind.
Good evening, I'm Kelly Shipley. I'm the Government Affairs Director for Brightspeed in the state of Wisconsin, and was asked to give a few comments related to the request of ours to get a BEAD resolution done through Waushara County. And really what that is a partnership for us to be able to apply for BEAD funds, which is the expansion of fiber throughout the state of Wisconsin, as well as Waushara County. There's just a little background, there's 206,000 broadband serviceable locations in the state of Wisconsin that are part of the BEAD program. Okay. All told, in Waushara County, there's 5,507 broadband serviceable locations. That gets into roughly 41 project units. The project units are based on the Public Service Commission's data. We, as a company, Brightspeed, we're looking at roughly 5,160 of those particular broadband serviceable locations as a potential BEAD grant. If we build every one of those, as an example, it's $23.8 million, roughly speaking, in capital dollars for the project. The reason that we would ask for a resolution is because there is a scoring rubric, which was mentioned previously, of 7 points to get a resolution from a particular county to partner with our organization, or any ISP for that matter, to go ahead for the project. We would love to be able to partner with you. As we continue to grow our organization, since we took over the old CenturyLink assets back in October of 22, we've been doing private builds throughout the state of Wisconsin. As an example, we're talking to City of Wautoma as we speak to do a project here. Some of the other projects we're doing are Wild Rose, Boisippy, Red Granite, coming up in 2025. And these are private builds. This is just funding that we are providing on our own from Brightspeed to build out fiber in areas that has been neglected for years with the old copper infrastructure. The other thing I really want to stress, which I think is extremely important for us asking for a BEAD grant and a resolution and a partnership, we are not asking for any money, period, from the county. We will self-fund anything that we do, as well as asking for a partial grant. Our grant match that we would look at from the state of Wisconsin potentially could be anywhere from 30% up to 50%. So think about the number I mentioned, $23.8 million. We could be up around $14+ million of our own strategic private dollars to build fiber back into those rural areas that need high speed, broadband services over fiber. So I'm here to answer questions if there's any questions related to that particular program. I know there's other questions that may come up about what we're doing as an organization. I'd be more than happy to field those questions after I'm done outside. For anybody who'd like to talk to me, I want to make sure I'm open and transparent with any questions that you have. So is there anything I can try to answer for you related to the BEAD program?
Does this resolution lock us into solely you as a provider, or is it multiple that we can do?
You can give a resolution to anybody, like any ISP that's out there. Yeah. And I would highly recommend that too. Other question?
Question about your company.
Yes, sir.
Are you planning on running it the same way that you're running your phone line business?
Yeah, that's a great question.
Because currently, just hear me please, currently your 911 service has gotten a big black eye in Waushara County right now. And your phone service has got a big black eye in Waushara County. I've got many constituents in my area
that are provided by your phone service that would rather have somebody else. Seriously. Frustrated through the safety committee. Several of us are on the safety committee, and every month Ryan has to come from dispatch and explain to us how frustrated he is with the 911 service. And it's unexcusable that our people in this county cannot count on a 911 service from your company. So I'm asking you if you're gonna run this part of your company the same way you're running your phone line service. Yeah, no, and I appreciate the question. I would be lying if I said I haven't heard this particular question in other counties that I've actually dealt with. And like I said, we acquired some assets back in 22 that we know there's gonna be issues with. We know there's some network optimization that needs to be done, which really means we need to put fiber in the ground and build out over an antiquated old network. A lot of things that happen with 911 could be related to maintenance, network maintenance from our perspective. Cable cuts are, and we've done some homework on this too. To answer your question, are we gonna run the organization the way we have been running it? No, that's not our intent. And that's why this fiber build out is so important to us as an organization, is to be able to get off that old copper network and to be able to get a more reliable network, quite honestly.
So what about your customer service? Because I can also express the frustration from Ryan that your customer service, when he tries to contact somebody, he's ignored and ignored and ignored. So I guess I'm also asking about your customer service. Is that going to change?
Two parts to that, I guess I could answer. So the basic customer service that you would get when you call in, say for an internet problem, and that customer service is kind of a separate service than what it would be for, say, the 911 service. We want to try to differentiate.
I'm talking about our 911 service. I'm
Yeah.
talking about Ryan from dispatch.
Yeah.
When
We need to do a better
when
job.
we have a 911 outage, he's ignored.
As many times that I have seen instances of issues with 911, to say he's ignored, I'm disappointed that that is happening. I can't say why it happened that way. I'd love to find out more about that. I've been involved with some of these. I was actually up here about a year ago, sitting with the sheriff, talking about 911 outages with our team, because there was a major outage roughly a year ago. And so to go back to your other original question, are we gonna try to do better and do better? Yes, the answer is to that. But this takes time, and we know what we bought a couple years ago, and we're trying to work through that. Thank you. Thank you for the question.
Okay, is there any other questions, Mr. Irvin?
I got a question with the, so if you have we saw a map up here with Bug Tussle and the areas that they're wanting to provide, and I know there's other providers that are hitting other points in the county with the fiber they're putting in. So do each of you own the fiber lines where that's just strictly for your use? Like, if there's, I guess the question is kind of like, if there's competing services in an area, is there multiple lines run, or how does that work?
Yeah, the BEAD grant program, there's gonna be one ISP, internet service provider, that will ultimately get those BEAD dollars, those grant dollars, to put in the ground. Whether or not another organization wants to run their own fiber or other lines on their own strategically, privately, that's up to them. Barry, do you have that one slide? Please. We have a few minutes, maybe I'll elaborate a little bit. Why don't you go to the next one? So that's our footprint traditionally in Waushara County. The orange lines designate the old, what we call ILEC, incumbent local exchange areas. Those were the traditional areas that we were the old phone companies, say CenturyLink. Might have recognized it as CenturyTel at one time. Might have been GTE, quite possibly Wisconsin Bell many decades ago. So we were that traditional phone company providing dial tone services and the DSL internet service at one, and still providing DSL to some people. Barry? So the goal is, keep looking at that slide, is to ultimately provide that 2 gig, 1 gig, 500 and 200 meg internet services in the areas that we're putting fiber in. So as an example, when we finish our build here in Wautoma, those are the speeds that would be available to anybody and everybody. Okay. Barry, next. That is the map of the Public Service Commission that is online currently that designates areas that are internet challenged. And when I say that those are areas that cannot get speeds at this time that are greater than 100 download speed by 20 upload speed. Within those particular colored areas, there could be anywhere from 1 to 50 to 100 BSLs. Remember I mentioned that about 5 minutes ago. A broadband serviceable location could be your house. It could be a community anchor institution, bank, a school, for that matter. And the goal from the state of Wisconsin's perspective is to get to every one of those locations. Okay, Barry, go to the next one. So our particular project areas that we're looking at in the colored dots that you see up there relate directly back to that slide, the previous slide from the state of Wisconsin Public Service Commission. So again, like I said, we have the opportunity to get to at least 5,160 locations. Outside of Waushara County, there's roughly 949 locations. We put that number up there because our traditional wire centers, those orange lines that we just showed, we go beyond county lines as an example. So we might get ourselves into Winnebago County as an example, maybe Fond du Lac, maybe Portage, okay? So we will go over those particular boundary lines. State of Wisconsin will not for their particular map, okay? So we may bring in some of those locations also as part of our BEAD grant for here, as well as say maybe Portage County, maybe Green Lake County as an example. I just want to make that distinction, okay? State contribution, I had mentioned. Our original modeling on this, I did mention anywhere from 30 to 50%. Our original model on this one was 60%. That number is going to change because the Public Service Commission does have some data that is still sitting out there that needs to be finalized. Okay, most of the data is done. We're just waiting for that match type information that they do need to get out to us at this time. Okay. Questions on that information? I appreciate the opportunity. If anybody would like to talk to me like after the meeting, I will be outside for a little while. Maybe I know there might be some folks that want to talk to me. It hurts, so I'll be outside. But thank you for the opportunity. We'd love to be able to partner with you and move forward. Timeline on the program. There is a timeline. January 15th is when the BEAD subgrant process is supposed to open as of today. I was on a call with the PSC today. It goes from January 15th to February 25th. Could that change? Yes. But as of right now, that is what they're shooting for. So it gives us roughly 45 days for that period to be open to ask for a grant. Thank you.
Thank you, Kelly. Okay, is there any discussion or any questions anybody has? Any discussion on this at all?
So,
Go ahead.
we're partnering with Bug Tussle, which is our competition.
Right.
So, okay.
And potentially, and correct me if I'm wrong, but potentially vying for some of the same customers. So.
Yeah, this vote's basically like giving them the opportunity to compete.
Right. So is there any other discussion?
Do I understand that it sounded like this is a all or nothing? This B grant is it?
Barry might, do you know, I mean, Barry, you're on the BEAD committee, you and Barry, but
It's my understanding that when they apply for the grants, they apply for the amount that they feel that they can cover. So Bug Tussle will likely come and ask for the same type of resolution. I have another one that just sent me a message today that's interested. And then, of course, Brightspeed would like that opportunity as well. So in the light of competition, it's going to be up to the PSC to decide who they want to give the grant funds to. We as the county just endorse we think these guys should get it. So when we talked about it in exec, originally we were just going to do, when I talked to Ruth about it, we thought it would be best just to say, if they want our support, we're up for the competition, and then it's up to the PSC to decide who's gonna get it. And it's my understanding that it would be all or nothing at that point. Like you said.
So we're not choosing who gets the funding, we're just passing it along.
Correct, and all this is just say that Washington County supports this service provider for getting a BEAD grant.
Apples to apples competition.
Correct.
Right. So. Any other discussion? Okay, hearing none, then we'll proceed to vote on the resolution. Okay, and the resolution passes. All right, next we'll move into resolution number 37-12-24. A resolution authorizing transfer of funds from the uncommitted account of the general fund to the treasurer's budget for the demolition of 327 South Wabaka Street in the city of Watoma. Is there a motion? Motion by Mr. Gray, is there a second? Second by Ms. McCormick. Any discussion?
I got a question. So is this a result of it's something that was intended for ARPA funds to be used for, and the ARPA funds are accounted for, so now we've got to draw funds from somewhere to make up for the.
There might be some ARPA funds that'll be able to go for part of this, but it would probably not cover the whole amount. Mike and I are also applying for a grant that will cover some of the costs related to the asbestos. But this really is to get rid of that blighted property so that it can go back on the tax roll. And the county is already out like $200 and some thousand in taxes that we haven't gotten over the years. This is the second time that we've taken it back. And it is unusable in the shape that it is in. But yes, some of it might have to come out of our general fund to cover the cost if we, depending on how some of the other ARPA things come out and the amount of money that we can get in the grant from the Wisconsin Economic Development Corporation that we're working on.
It'd be far better to use it or to get rid of it and use it as lots or whatever, something that would be usable in the town. So is there any other discussion? Okay, hearing none, we'll proceed to vote on this. Okay, the resolution passes. Resolution number 38-12-24, a resolution to reclassify certain finance position on pay scale for 2025. Is there a motion for that resolution? Motion by Ms. McCormick, second by Mr. Urban. Is there any discussion? No, that's just for those three positions, the finance director, highway account manager, and public health office manager. Any discussion? Okay, hearing none, we proceed to vote. Okay, that resolution passes. Resolution number 39-12-24, resolution to hire an AODA case manager to be assigned to the jail fund by the state opioid response grant. Is there a resolution or is there a motion? Motion by Mr. Johnson, second by Mr. Gray. Is there any discussion on this?
I would note that we did get our official award letter from the state, so that grant has been fully secured at it's over $157,000 a year to maintain that position for the 3 years. And then if there was not additional funding somewhere else for it, this would sunset. So it's going to be hired as a limited term employee at this point in time to see how we can work it in going forward.
No more questions or concerns. We'll go ahead and vote on that. Okay, and that resolution passes. Resolution number 40-12-24, a resolution to amend the plan for use of American Rescue Plan Act funds, updating and amending resolutions 40-08-21 and 11-08-23. Is there a motion for that resolution? Motion by Mr. Peterson. Is there a second? Second by Mr. Urban. Is there any discussion? these have to be allocated like we talked last month before the end of the year. So, seeing no questions, we'll go ahead and vote on that. Okay, and the resolution passes. Resolution number 41-12-24, a resolution authorizing cancellation of outstanding checks. This is for the county jail inmate trust account. Is there a resolution or a motion for that resolution? Motion by Mr. Gray. Is there a second? Second by Mr. Bossard. Any discussion? Okay, hearing none, go ahead and vote. And the resolution passes. Resolution number 42-12-24, resolution authorizing one additional deputy for Sheriff's Department. Is there a motion for that? Motion by Mr. Kirschner. Is there a second? Second by Mr. Peterson. Is there any discussion?
Yeah, the budget.
This will be fully funded, like the contract that we have with the town of Marion, where they pay for one deputy for 2,084 hours. 2,184 hours per year, and they pay the full cost of salary and benefits to cover the township of Marion. The township of Coloma and the village of Coloma, have already agreed to a 5-year contract. So it'll be a position that will only last as long as the funding lasts for, but they will pay all of the salary benefits and training costs for that individual, plus maintain the car and pay for any equipment costs that are associated with the position.
Any other questions? No questions? All right, we'll go ahead and vote on that then. Okay, and that resolution passes. Next, we have an ordinance number 691, an ordinance amending Waushara County Code, Chapter 46, Article 1, sale of tax delinquent property. And that's just kind of updating what the state did. Motion by Mr. Wadle. Is there a second? Second by Mr. Urban. Is there any discussion? Okay, seeing none, we'll go ahead and vote. Okay, and that ordinance passes. Ordinance number 692, ordinance amending Waushara County zoning maps pursuant to the authority granted in chapter 58 Waushara County Code Zone Change for Stephen Gabrielson, town of Leon. Is there a motion? Motion by Mr. King. Is there a second? Second by Mr. Wadle. Any discussion? Okay, hearing none, go ahead and vote.
Is yours not working? Oh, there we go. Okay.
Okay, and that ordinance passes as well. All right, now we'll move into appointments. The Veteran Service Commission, John F. Bronk from Elman. His term is January 1, 2025 through December 31st, 2027. Is there a motion? Motion by Mr. Gray. Is there a second? Second by Ms. McCormick. Is there any discussion? All right, proceed to vote.
Mr. Wadle?
And that appointment passes. Okay, then we have one proclamation recognizing January 19th through the 25th, 2025 as Medical Legal Death Investigator Professionals Week. Is there a motion? Motion by Mr. Gray. Is there a second? Second by Mr. Bossard. Any discussion? Okay, hearing none, go ahead and vote on that. Okay, and that proclamation passes. All right, we're up to board suggestions for future agenda items. Is there anything anyone would like to bring forward for another meeting? That's on next month. I believe he's going to keep updating us.
I can do that.
Yep. Anything else? All right, then I would look for a motion to adjourn. Motion by Mr. Urban. Is there a second? Second by Mr. Peterson. All right, we're adjourned. Thank you very much.